Welcome back to Mirabicono's Education, where we provide you with diabetes content. Diabetic ketoacidosis, or DKA, is a life-threatening complication of diabetes that can lead to coma or even death if left untreated. Now, that's a scary thought, right? Don't worry, because this video is all about DKA. We are going to take a closer look at diabetic ketoacidosis. We'll discuss everything you need to know about DKA, from its causes and symptoms to its treatment. But before we dive into the topic, make sure to hit the subscribe button and turn on the notification bell so you never miss out on our videos. Let's dive into the basics. What is DKA, or diabetic ketoacidosis? DKA is a serious acute complication of diabetes that is common among people with type 1 diabetes, but people with diabetes type 2 can also develop DKA. DKA develops when your body doesn't have enough insulin to allow blood sugar into your cells to be used for energy. It can also be caused by other factors such as an illness, infection, missed insulin doses, or improper insulin administration. Let's talk about the pathophysiology of DKA. Normally, we have glucose in our bloodstream that needs to be transported into our body cells as energy so that we can function properly. For this to happen, we need insulin from the pancreas to transport this glucose from our bloodstream into our body cells. Once the glucose is in the cells, then we have energy and can function properly. But with diabetic ketoacidosis, there isn't enough insulin, or there is no insulin production to take the glucose into our blood cells. As a result, there is an increase in the blood sugar level. Because our body is in need of energy, it will try to compensate by taking stored glucose from the liver and transport it into our bloodstream. This is as a result of lack of glucose, and because there is no energy, it thinks that the body doesn't have enough glucose. So now, because the body desperately needs glucose, what it will do is it will start breaking stored fats to convert into glucose for our body to use as energy. With glucose from the liver and fat cells, the blood sugar rises even more, and this scenario keeps repeating itself. In the process of breaking these fats into glucose, the body produces ketones. Ketones are waste products from fats, and these ketones get stuck in our bloodstream, causing the kidneys to become overloaded and eventually the fails. The kidneys failure causes the ketones and glucose to continue to build up in the blood. The body then acidifies, causing organ failure, and the patient goes into a coma. This process is best known as ketoacidotic coma. The symptoms of DKA can include increased blood sugar, excessive urination to get excess glucose and ketones out of the system, excessive thirst. This is as a result of the excessive urination. Tiredness is caused as a result of lack of glucose in the cells to be used for energy. Dehydration, which is linked to excessive urine. Dehydration can cause dry skin, low blood pressure, and also fast heartbeat, rapid respiration, or the Kussmaul respiration. The patient's breath will smell like a sweet apple. The patient piles up a lot of CO2 because the body is acidified. And to get rid of this CO2 quickly, the patient will tend to breathe quickly. Abdominal pain is another symptom of DKA, which in extreme cases can lead to vomiting. The consequences of DKA is coma that can eventually lead to death. So, how do we treat DKA? DKA is a medical emergency that requires prompt treatment to prevent serious complications. The first thing to do is to control the sugar level to confirm high blood sugar. Also, control the amount of ketones in the blood. This can also be done via a finger prick with a ketone meter. Treatment of DKA typically involves administering fluid to hydrate the patient, insulin drip to lower the blood sugar level, and also the correction of low electrolytes. With insulin drip, it is advisable to monitor the blood sugar level for low blood sugar. If anyone has to vomit due to high blood sugar level, this can be a sign that the body is acidifying. Immediately call a doctor or the help unit, for this is life-threatening. Remember, vomiting is equal to a call. It is important to monitor your blood sugar levels regularly. Take your insulin as prescribed and seek medical attention if you experience any symptoms of DKA. If you have any questions or comments, feel free to leave them in the comment section below. We love hearing from you. If you found this video informative and helpful, make sure to give it a thumbs up and share it with your family and friends. And don't forget to hit the subscribe button and turn on the notification bell so you never miss out on any video. Thank you for watching. Bye.